Hey guys, it's Dr. Miller here. We are going to chat today about dental trauma. We are going to talk specifically about adult teeth. So even though this happens really commonly in children and young adults, if your child's about 5 or 6 or younger, most likely that tooth is a primary or a baby tooth, and that has a whole different set of protocols and guidelines to follow. But if there is trauma to an adult tooth, the very first thing you want to do is check and make sure the rest of the health of the body is doing okay. You want to make sure there was no loss of consciousness, no concussions, no big neck injuries or anything like that. Once that's settled, you want to see if you can find the piece of tooth that broke off, or in some cases if the whole tooth comes out, you want to look and see if you can find that. If you cannot find it, we may recommend that you get a chest x-ray done so that we can evaluate and see if it has been aspirated, because that is a risk with these issues, and we don't want anything to end up in the lungs that shouldn't be there. So once we found our piece of tooth and we know where our head and our neck aren't injured, we want to really evaluate and see what happened to the tooth and how emergent the treatment is. I do recommend calling your dentist right away, chatting with them over the phone to see if it's something they need to see you immediately for, or if it's something they can schedule you to take care of. I have an order here kind of not quite as severe to a little bit more severe trauma. This one, you got a chip off the edge there, but overall that's most likely still in that outer enamel layer. That can usually be repaired fairly easily, either by gluing that piece of tooth back onto it or using some composite filling to build that tooth back up. On the other end, we have a fracture that's led to pulp exposure, so the nerve of the tooth is exposed. So if your tooth were to fracture off and you can see some red or actual bleeding coming from the tooth, we know we're going to need to do a little bit more invasive treatment to save that tooth long term. If something even a little bit more extreme happens, where the whole tooth were to come out, first thing you want to do is, once you've found that tooth, is you only want to touch it by the crown, so the part that you can see in your mouth. You don't want to touch the root of the tooth. You do want to give it a good rinse off. Do not scrub it, just let it rinse in some tap water, and then place that back in the socket as quickly as possible. The sooner it gets put back in, the better the long-term prognosis is of saving that tooth. If you are unable to get it into the right position, if you feel like you're not sure which way it goes, or if there's just a lot going on, it's too sore and you just can't do it yourself, what we want you to do is stick that whole tooth either in a cup of water or a cup of milk, a cup of saline, or even put it in some saliva. You could even potentially just stick it right on the inside of your cheek there. We really want to keep that tooth moist. We do not want it to dry out. And you want to get to your dentist as soon as possible so that the dentist can then reimplant that into the site. Once that tooth is put back in, either by you or by your dentist, the dentist will probably put like a split right across those front teeth to stabilize it for a couple of weeks until that bone can kind of grab onto that tooth again. Teeth that have come out will generally need root canal treatment to be saved, but we want that bone to heal up around the tooth initially. So if you have any sort of trauma, first thing you want to do is just make sure the rest of the body is nice and healthy. Then definitely give your dentist a call and have them walk you through the steps of what to do if you're not quite sure.